You are listening to Hillary Topper on Air. And now, here's your host, Hillary Topper.
Welcome back to the show. Today, I've got an exciting guest with us who brings a blend of artistry, science, and compassion into her work every single day. She's a board-certified plastic surgeon and co-founder of Evolve Plastic Surgery right here in Queens, New York. With her expertise ranging from breast and body contouring to non-surgical treatments, she's someone who's redefining what it means to help people feel confident in their own skin. Please join me in welcoming Dr. Irena Karanetz to the show. Dr. Karanetz, we are thrilled to have you. So to kick things off, can you give us a brief overview of your background and, what inspired you to pursue a career in plastic surgery? And how did this path lead you to co-founding Evolve Plastic Surgery?
Yes. Hello, everybody. Thank you so much for having me here with you, Hillary. So my name is Dr. Irena Karanetz, and I'm a board-certified plastic surgeon here practicing in New York. So my path to becoming a surgeon started back in Chicago, actually, where I went to medical school, and that's where my exposure to surgery, my first exposure to surgery happened. And what I loved about surgery in general is that I could see immediate results of whatever procedure we did, rather than, to me, at such a young age as a medical student, I know we can prescribe a medication and perhaps we'll see a patient get better, in a couple weeks, couple months. But what drew me to surgery was seeing us in general surgery, even then, that patients were getting better, whether they come in with appendicitis or gallbladder. So it was that rewarding aspect of it and the immediate results. And originally I thought, well, this surgery is great. Maybe I'll be a general surgeon. And then I was lucky enough when I was at Rush University in Chicago to do an elective in plastic surgery. And that's where my then exposure to plastic surgery happened. And I realized that it's so comprehensive. We could be helping little babies with clefts one day, and another day we would be doing cosmetic surgery or helping weight loss patients who are, truly uncomfortable and dysfunctional because of all the extra skin. Even back then, I was drawn to working with breast cancer patients. I always felt that is so rewarding to be able to help women during such a vulnerable time in their lives. And then I realized that, I think plastic surgery is even more meaningful and more comprehensive. And I decided to pursue that. And that drew me to New York, where I completed integrated plastic surgery residency, which was 6 years. And then I did an extra year of fellowship focusing on the breast. So breast procedures, whether it's cosmetic or reconstructive, like we said, for breast cancer, that is a big part of my practice, besides, of course, doing other body procedures and what everybody else thinks of plastic surgery. So I do it all, but breast is holds a special place in my heart and those patients.
Absolutely, especially since breast cancer is so prevalent here
Yeah,
on Long Island and in New
absolutely.
York. So, can you tell us a little bit about the philosophy behind Evolve and what sets your practice, apart from others?
Absolutely. So me and my partner, Dr. Yoel Rojas, who's also a board-certified plastic surgeon, we've both been in practice for many years. But then a year ago, in May 2024, we founded Evolve Plastic Surgery. And, we've been colleagues and friends for many years. So our philosophy to how we treat patients, how we talk to patients, and how we strive for truly the best results in the safest manner, we always had that in common for many years. So that philosophy was kind of embedded in us already. So again, our main goal at Evolve Plastic Surgery is to, for potential patients, is to create a very much so personalized approach to each patient, whatever bothers you, whether it's your abdomen or your breast or your face. And it doesn't mean you want to change. I think that's where people get scared. Plastic surgery is going to change who I am. That's not the goal. The goal of plastic surgery is to help enhance something that you're uncomfortable about. And it could be one part, sometimes it's 2 or 3 things, and we come up with personalized approach to you. And again, the goal is to come up with a plan together. You know, both me and Dr. Rojas, we really give our patients time. We sit down with them and we listen and we give them, and that's another big part of our philosophy. We try to come up with a collaborative plan together with the patient so that their vision is reflected in our work. And we truly embrace that that personalized approach with, of course, superior results in a safe environment, and using innovative techniques and technologies, because we're both young plastic surgeons. We want to embrace and bring all the best to our patients. And we're proud to offer that at Evolve Plastic Surgery.
That's awesome.
Thank
So
you.
talk to me a little bit about some of these non-surgical treatments like Botox and some of the others. I mean, what exactly do you offer? What are they? You know, I mean, even Botox it needs to be debunked. Like there is so much out there, misconceptions, and it would be helpful, I think, for my community to know what exactly is out there for them. And, will they look weird if they do Botox? Like, what is this like, with the filler? I hear things with filler and things floating and all that kind of stuff. So can you explain some of that stuff to us?
Yes, we can do some myth busters here. So of course, we as surgeons, we do procedures that are surgical, but a lot of things can be done to enhance your face or even body with non-surgical techniques that are minimal downtime, right? In this busy life, in our busy lives, everybody wants an improvement, minimal downtime, everybody's busy. So what can we do to again enhance your beauty while you still look, feel yourself just even more beautiful, more refreshed? I tell often my patients, and I love when I get during consultation my first time patient, whether it's Botox or filler, because I really what I do is we sit down together with a mirror and we kind of do a facial analysis, and I explain to them, let's say, if you raise your eyebrows and you have a lot of lines with animation, because Botox works on your facial muscles, that can be softened with Botox. It's not going to change who you are, but when you talk to a person, now it's just going to be a softer look, more refreshed, more youthful. And we go over that again. Botox, it's temporary. It works 3 to 4 months, and then your body breaks it down. So again, it's safe. Otherwise, we wouldn't have been doing it for so many years. So again, Botox is a way to address the wrinkles when you move your face. And then I'll kind of move down with the patients, talk about fillers. Again, people have seen the big overfilled faces, cheeks. They're scared. They tell me, I don't want that. And, again, at Evolve, with our philosophy with Dr. Rojas is enhancing natural results. We call it facial balancing. So let's say if somebody's aging, and I see this a lot with women, and we'll talk separately about younger patients because that's a huge population with preventative Botox, preventative things. But let's say a woman, as we age, one man or women, we see both males and females in our practice, the face starts drooping here. They start seeing jowls. Nobody likes it. Everybody wants like a nicer contour. Not everybody wants to have a facelift, right? Facelift is surgery, scars, downtime. It is expensive. So some of my patients will come in and say, what can we do, doctor, to make it better? And, I have an hour or I have hour and a half. And that's where we come up and talk about fillers. Again, fillers are also, they're made of, a lot of them, hyaluronic acid, which is already part of our body. So again, it's not like we're injecting something foreign or toxic. And then again, it breaks down within a year. There are other products like Belafil that they're a little more longer lasting, but they also have regenerative properties that they'll make your body from collagen. So, and it can be, I'm injecting Botox here, I'm doing Bellafill here, I'm doing a hyaluronic acid filler elsewhere, and then we'll discuss, that treats the wrinkles. But we can't ignore the skin texture, right? Or pigmentation, or again, the droopiness, the jowls. And that's where a lot of skin tightening microneedling comes in, like Morpheus 8, which is like the amazing newest technology where it helps remodel and tighten the skin. So, and then I'll tell patient, that can be done within an hour and a half. You can go back to working out the next day. And again, it's going to be an enhancement, an improvement without changing your face, that you look totally different. And we always kind of like build up. We can start with one area and then add something else during the next visit. I'm never pushing that, let's do it all at once. Especially for my new patients, I take my time. And again, at Evolve, we take pride in relationships we establish with our patients. It's not like you come in for surgery and you're gone. Those same patients then come back because they trust us to do their faces. They bring their cousin, the family members, friends, because they know that, we listen, we take time, and then we come up with that personalized approach, whether it's surgery or non-surgery with our patients. So we're lucky to have so many surgical patients that trust us with non-surgical enhancements as well.
So let's go back to something that you said before about how younger people are using Botox as I guess
Preventative.
preventative, right?
Yeah.
Exactly. So, and it seems like many of my daughter's friends are doing it. Um,
And lip fillers are big. I know younger
Yeah.
women, they like plumper lips too. So that's big. We see that in younger population. And again, I don't think there is nothing to be scared of. I've been doing Botox since my late 20s because I started having the lines. So to me, a lot of patients, if I see the lines and they bother them and we can improve it, that's where you start Botox. If you don't have the lines, maybe we talk about skincare. Maybe we talk, you got to use, sunscreen and retinol products, and maybe we can do Morpheus, which helps. Again, it's kind of like reverse aging. What can we do? What can we add to make you age gracefully, even, starting from your 20s to your 30s? So, yep.
It's interesting, right?
Yeah.
So let's go back to fillers also. I want to ask about that because what I've heard, and maybe I'm wrong, I don't know, is that when you get fillers, they float to different areas of your face. Is that correct? And how can you alleviate that?
Yeah. So ideally, I think I would say I'll bust that myth a little bit. So, when injected properly, the filler has to stay where it's injected, but it also depends on the injector, the person doing it, the choice of the filler, like which product and where it's injected. So fillers can be, I love fillers because they're a little moldable. But they shouldn't migrate, because that's where, of course, like if you're injecting it in a lip and you overfill and overdo it, and now you have the duck lips, which some women might like it. A lot of my patients want natural result. I don't put as much. So it's a lot of factors go into that. A lot of my patients, they like, make my lips plumper, more defined, natural. I don't want to have the big duck lips. So it's, a lot of little pointers how we can achieve that result too.
What's interesting too is that a lot of non-surgeons are doing this type of work.
Absolutely, yeah.
So talk to us a little bit about that. Like why should somebody go to a surgeon as opposed to a nurse practitioner or somebody
Mhm.
like that?
Yeah. So to be honest, Hillary, there are a lot of excellent injectors there. And I think it's inevitable that a lot of nurse practitioners, they have a lot of hands-on experience, PAs, even nurses, they become injectors, they go to courses, they get trained. And I think, again, when you are licensed and credentialed and you do the courses and you're safe, I've seen beautiful results. So I have I'm fully supportive of other specialties doing it as long as the provider not the provider, as long as the patient knows that they have those credentials, that they've done the training. Because again, you don't want to go to somebody who doesn't understand facial anatomy and now your filler is injected in the wrong place or your eyebrow drops. So again, it's all about safety, whether it's a plastic surgeon or NP or dermatologist, right? A lot of people do that, even dentists, they do courses. But I would want to make sure patients, ask the right questions, they've seen their before and after results, and that they are educated. And then I think a lot of excellent injectors out there to go to.
So let's go back to your dedication to breast cancer reconstruction. I mean, that is amazing that you do that, and that's one of the big focuses of your practice. How has this part of your practice shaped your relationship with your patients and informed your approach as a surgeon? You alluded to it a little bit, but I'd love
Mhm.
to hear a little bit more about that.
Absolutely. Thank you. That's, breast cancer patients, they are a very special patient population to me because I really meet them at a very vulnerable time. For us as women to lose your breast or your both breast or part of your breast, that defines us as women. So, it's I feel like truly special that I can be there with them during this journey and that they've chosen me because it's very tough, and I get to meet their families too because everybody's going through that with them. It's such a big usually involves multiple procedures as well. So and these women have taught me truly, what resilience mean, and they've taught me to be even more patient with my patients, to listen even more deeply, to because they're dealing with so many other things where they'll, while one part is doing surgery or reconstructive surgery, let's say to rebuild the breast, or they've had surgery. I do a lot of revision surgeries and they're not happy. And so many women come in with tears in me because, and I can relate to that as a woman, that I know it's not the same. And I tell them, unfortunately, it will never be exactly the same, but we can improve upon things. And that's a lot of my conversations, listening to them and also establishing realistic expectations with them that I wish I could give your breast back, but I can't. We can rebuild it. We can make what you have better, and I'm with you. And it's usually a journey. Yeah, especially if somebody has had surgery years ago and they come back to me, I'll tell them sometimes we have to start from scratch and they may take multiple surgeries, but we're on this journey together. I'm there for you. I'm listening to you. I'm with you 100%.
Mhm.
But it can take time to get to that um, more improved aesthetic or cosmetic result. But I do feel that, they are comfortable with me as a woman and sharing that I have a little different approach and understanding, just because I understand how important breast is to women, and defining beauty and wearing clothes that they like and the dresses you like in the summer, and being naked with your husband, and I hear this all the time, and how they just don't feel like themselves. And
Mm.
even recently I did a patient surgery like a week ago, and maybe that was her fourth or fifth surgery already. And then I saw her for follow-up with her husband. And of course, she's exposed and we're looking together. And even that improvement, she was so happy with. And of course, husband's happy because, happy wife, happy life. So much. And I think I want to focus on that. So much mental and emotional state is tied to how you look. That's why plastic
Mhm.
surgery, I don't think it's vain, but if you feel good, how your mindset and your body, they have to line up. And it's especially like switching even to say weight loss patients, they've lost so much weight, they're so proud of it, but when they look in the mirror and see all the droopy skin, it doesn't
Yeah.
reflect this young face. And that's where, again, truly empowering surgeries for weight loss patients, how it can give them so much more confidence. And I think, again, plastic surgery should not be about changing who you are, but enhancing how you feel in your own body, in your own skin, empowering you to be the best version of yourself. And we're there for them, you know, along the journey, coming up with the plan and kind of getting them to that better point. And there is nothing more rewarding than seeing patients coming in and you feel the energy change. You feel the confidence, the way they walk in. Some of them are so reserved. I see that in their body posture. And then we'll do surgery, they've recovered, and they come in, and it's just the whole energy, the confidence, how they carry it. It's unbelievable. And I feel so blessed to have such an amazing job where it's quality of life, right? I'm not saving lives. We are not saving lives, but it's so empowering what we're able to do to help men and women feel more confident and empowered in their own bodies. So
I love that.
yeah.
That's awesome. That's
Thank
really
you.
awesome.
No, it's a great field to be in. So I feel very, very lucky.
So, talk to us a little bit about what your hopes for the future of the practice is and how you plan to continue innovating in the field.
Yes. So me and Dr. Rojas, my amazing partner, you know, we're big dreamers. And again, even the name Evolve Plastic Surgery implies that we want to constantly evolve, right? For our patients to evolve and for us to evolve as a practice. And again, the centerpiece, the focus will always remain this personalized patient care, where every patient, we give them time and patience, we listen to them, and you know that will not change, but we want to keep, you know, growing and expanding. And again, a big part of our practice is embracing innovative surgical techniques, and again, the newest advancements in technology, different skin tightening machines, newest implants. For example, there are newest FDA approved Motiva implants that we started using in our practice. So, and the newest skin tightening machines, we have them because we see that we are able to take the results from, let's say, what was great 10 years ago. Now, if you add extra energy skin tightening devices that use radio frequency, it's even more optimal results, more defined, more beautiful. So we want to keep expanding, keep embracing technology and the newest materials, newest advancements in plastic surgery, and the main goal is our patients, because we want them to look their best and then they feel their best. So definitely. And same with non-surgical stuff that we do. Again, the injectables, we always have the newest ones, everything that's, you know, FDA approved. So again, everything's done with the safety in mind, but also keeping up with what's the newest and the best out there for our evolved patients.
Oh, that's awesome.
Thank you.
So now you're located in Queens. Where exactly are you in Queens?
Yes, so currently our office is located in Oakland Gardens, Queens. It's kind of Queens, NASA border. It's 21318 Union Turnpike, Oakland Gardens. And we will be having an office on Long Island as well. So that's in the works. So stay tuned for more.
That's exciting.
Yes. And then again, we have a lot of information about our practice, the procedures that we do before and afters on our website, which is www.evolvesurgeons, plural, because it's two of us.com. Same with Instagram, evolve_plastic surgery. My Instagram page, Dr. Irena Karanetz, my partner, Dr. Yoel Rojas. And if the phone number, again, if anybody wants to, and it doesn't mean that you have to know that you want to do surgery. Sometimes it's a consultation to discuss what you've been thinking. You know, for many years, typically patients don't see a plastic surgeon for something that they woke up one day and are saying, oh, I want to talk about my nose or my stomach after having babies 5 years ago. It's kind of, especially a lot of our patients are women, we've been thinking about it. We've been reading a little bit, but sometimes you need an expert. And again, it's important to seek a board certified plastic surgeon and then discuss your option. It doesn't mean that the timing is right for you now. Sometimes women, we're busy, summer, kids, plans. But I think it's great to discuss and understand what may be your options during consultation. And again, we do virtual consultations if somebody lives further out east on Long Island, or we have patients come from New Jersey and other states. And even virtual consultations are a great starting point. But of course, if we're doing surgery or we're doing procedures, we meet patients in person. So Yeah.
And how does that work in terms of insurance? I mean, I would assume that insurance doesn't cover certain things, but covers other things.
Yes, great question. So a lot of cosmetic procedures, let's say breast augmentation, which is just breast implants, that's not covered by insurance. But for example, if it's breast cancer implant surgery, of course, that's covered. And I'm not sure if a lot of women know, but if you had cancer on one side, you can actually have symmetrizing procedures covered on the other breast as well. So
Oh.
again, a lot of revision surgeries, if anybody is interested in discussing options, I love doing those cases. They are challenging, but also very rewarding. Even let's say weight loss patients, with certain insurance plans, if you prove that that extra skin causes rashes, irritation, skin removal may be covered by insurance, but let's say full tummy tuck is not covered. So we come up with a plan, again, where sometimes it's a cosmetic and an insurance component, and we work with patients. We have different financing plans. Another common procedure that I do a lot of, and a lot of plastic surgeons do them, is breast reduction. So breast reduction is covered by insurance a lot of the times because women get discomfort with the shoulder pain, and neck pain. So again, breast reductions, we often get approved and covered through insurance as well.
That's so interesting. Well, I just am really floored. I really am. This was fantastic, Dr. Karanetz. So thank you very much for joining us
Thank you.
today and sharing your story. Your passion for your work is amazing, and that just shows through so much.
Thank you, Hillary.
So thank you all for tuning in today. If you want to learn more about Dr. Karanetz and Evolve Plastic Surgery, check out their website at
Evolve,
evolvesurgeons.com.
yes, evolvesurgeons.com.
Evolvesurgeons.com. Thank you.
And the phone number I have as well. Again, if anybody has a desire to schedule a consultation or talk about any enhancements, surgical or non-surgical, our main phone number is 516-981-3063. So again, I wanted to leave that out there as well for your listeners.
Thank you so much. This show was produced by Hillary Topper and sponsored by the Russo Law Group, Long Island's signature elder law, estate planning, and special needs law firm. For more information, visit vjrussolaw.com. And PlayTry, your multi-sport specialist for all your triathlon needs. They have so many opportunities, including franchising. If you love the sport of triathlon, check out playtry.com and learn more about opportunities, or if you want to shop there, check them out. They've got great prices and they've got amazing customer service.